Kristen Ayers loves the great outdoors. She enjoys hiking, rafting, and running. But a few months ago, her training for a half marathon hit a roadblock.
I was at the gym doing some lateral jumping, and I twisted my ankle when I landed. I heard like a pop and immediate swelling, and I couldn't stand on it.
Fortunately, it wasn't broken, but Kristen suffered a severely sprained ankle.
Any pain right here?
Interestingly, Dr. Bridget Quinn, director of the Women's Sports Clinic at Beth Israel Deaconess Medical Center, says there has been a rise in female sports injuries over the past 30 years as women have become more active in athletics. In fact, women are more prone to certain injuries than men, in part because our bodies are built differently.
I like to think of it in terms of cars. You have the wheel, you have the body, etc., so forth, but they function differently to some degree. We tend to have wider hips. We tend to have thigh bones that go more in like a V. We tend to have feet that roll in a little bit more than men.
In particular, pivoting and cutting sports like soccer and basketball can result in a much higher degree of knee injuries for females, a 2 to 6 times greater risk of tearing an ACL than their male counterparts.
These risk factors start developing once women hit puberty, so there's definitely some sort of hormonal contribution.
Eating issues are also a factor. Women are more likely to restrict their diet, says Dr. Quinn, believing that being thinner makes them faster or more aesthetic. But a lack of proper nutrients, including vitamin D and calcium, can make bones weak.
They put themselves in this energy deficit, if you will. So a lot of girls think, okay, if I eat 2,000 calories per day, I'm fine, but not if you're expending 2,500 calories in a long distance training run. So there's this misunderstanding in the community of how a female athlete should eat. And then that can set them up for some other dangerous conditions like repetitive stress fractures, which I do have the tendency to see more commonly in women.
She also sees more shoulder and hip problems and ankle sprains across many sports because a woman's joints are actually more flexible and they're able to push their joints to greater limits before their bodies tell them to stop. But Dr. Quinn studies one activity where women are on point to prevent many of these injuries: ballet.
What we understand now is that we can almost untrain the bad habits that women develop once they hit puberty. So we can train women to learn how to jump, land, cut, pivot. We can teach them how to quote unquote do that like a guy would do it, but it's really just good biomechanics. And that's really what dance has always been all about.
Regardless of the sport, Dr. Quinn says there are things women can do to lessen the chance of a serious injury. Those include paying attention to diet, get plenty of calcium and vitamin D, keeping weight levels high enough to continue regular menstrual cycles. Having a period is important to bone health. Listening to your body. Know when something feels off and don't push it. And if you think you're injured, seeking medical care immediately. That's one tip Kristen wishes she had taken. After 2 months, her ankle is still stiff.
I didn't really seek as much treatment as I probably should have. I didn't wear a boot. I used crutches for like a day, but I didn't do any formal rehab for it afterwards.
And Dr. Quinn suggests female athletes do one other thing: work a variety of body parts by adding different activities like swimming or even yoga.
Variety is the spice of life, and I think a lot of people end up focusing on their one sport, be it dance, be it running, and they really need to understand that you really shouldn't be running every single day. You need to let your body recover and allow your body to feel different movements to keep it healthy and balanced.